when we think about training the future of healthcare and our healthcare professionals, what policies and procedures do you think could be put in place to really address their mental and wellness needs?
I mean, I think you have to give people tools. Wellness is, you can't sort of prescribe the end product because you don't know what it is that people are going to need. And everyone's going to come to this job with their own sort of unique experiences. But I think you give people different tools that they can use to navigate forward. I do think that schools are doing a better job now of sort of introducing like medical ethics and sort of this idea of professional identity formation, and even just something as basic as being able to reflect on what it is that you're going through. I think schools are doing a better job at that. And there's certainly a much bigger push towards like a holistic sort of application process so that we bring in people who are maybe slightly more predisposed to be a little bit more reflective and a little bit more in tune with what's going on with their internal selves. And I think that can be like a very useful skill because even you don't know what's going to come up. And so the ability to at least evaluate like, ooh, this thing happened and how is that impacting me? And then how can I respond in like a good way, and having that ability to do so. But like, again, you foster this idea that there's tools that you can give, and then there's like normalization on top of that. And again, I think we're doing a better job of saying, you and I are here talking about this, like this probably wouldn't have happened, however many years ago. And the fact that, in schools and in residencies, people are talking about burnout and depression and like physician suicide and all these things that people are actually now speaking about can be helpful from a normalization perspective. So I think in general, we're doing a much better job. It's just going to take a while for us to see it, because for these students and these residents to then go out and practice and then become attendings, and then as attending kind of influence the generations that come after them.
So in the emergency room, so things move so quickly, and at what point do these residents have time to really process and reflect on what they've experienced?
It's a great comment to bring up. I mean, quite frankly, some of it depends on where you practice, right? But most of the time, whenever there's a critical event, usually there is very little space, and certainly not enough space to deal with that emotional sort of all those feelings in the moment. Some places, so our shop included at Maimonides, but there are multiple other institutions that do this, have instituted formal debriefing processes that can be very helpful. So some of them are triggered by certain events. So like a death or a trauma, or like there's certain very standard events that will trigger this. And other times it can be anyone who's sort of provided in a case that feels like they need debriefing. Other times it's just every standard resus patient or critical patient. But there's this idea of a hot debriefing, a warm debriefing, and a cold debriefing. And depending on the time, the situation, I think there's a role for all of them. I think there is some role for processing in the moment, but then also giving some time to reflect later. But I think the important part is recognizing that, as you said, there are really emotionally challenging things that happen in the emergency department everywhere in the hospital. And it's important to give space to that. But I think in general, there's been a greater trend towards recognizing that this is really important, right? We have to take care of the providers if we need to, in order to take really great care of our patients.
Mm-hmm. Mm-hmm. And it first starts with addressing the issues and having these conversations like we're having, right? And really making, emphasizing that there's nothing wrong with not feeling like you're okay.
For us, by us, and just for us, this is hope for med.